We've invited the public and clinicians and managers together today to start to explore what it is people need to feel supported to live well with their long-term condition. We've recognised through other events that we've done in Mid Sussex and Horsham that people want to meet with other people, for example, in order to understand more about their condition and feel supported.
I'm speaking today about our Nesta and Cabinet Office funded peer support project, how we identified the problems that we wanted to address and then how we've gone about achieving those, and also giving some people some ideas and advice on how to set up peer support groups if that's what they would like to do within their own local communities.
So my main advice to anyone starting out is to keep it really, really simple. At its core, peer support is people getting together and having a chat.
We run a little social club at the Dolphin Centre in Haywards Heath. By meeting in groups, we were more open with each other of what's wrong, where people don't really talk about things like that.
Being social and being engaged in your community is massively beneficial to your health, even more so than some interventions that you can take. So the flip side of that is that being socially isolated is worse for you than something like smoking.
As a GP, we know that there are folks living very lonely lives, and we try and support them to link in with local day centres and opportunities.
Yeah, perhaps I would like some more information on the peer support and see what is going on around here. Because of my condition, I'm becoming more and more isolated and indoors. And really I need to get into these groups to actually socialise. Yeah, I found it very interesting actually meeting, because I've met with other people that have got the same condition, and I've also got to meet professionals as well and been able to put my point of view across to the professionals.
I think it was fantastic that there were so many patients there today, and I think that that brought up a whole lot of interesting issues to discuss. Having those range of experiences in the room, as well as that range of professional experience as well, just sparked some really interesting discussion.
Well, the event today was very positive, very good. I found it useful, and I think everybody here found it useful. I've never been involved in peer support groups, so I came open-minded. It'd be an interesting experiment to join one.
We've learnt a lot today, understanding what it is folks want and need to help support them to live with their condition. I think we can springboard off of some of those conversations today to actually make something really quite interesting happen within our town.